I am going to be inserting an indwelling urinary catheter on a female patient today. I would start by knocking on the door. I am providing privacy. I would wash my hands. I would don gloves and introduce myself to the patient. Hi, I'm Simone. I'll be your nurse for today. And could you please state your first and last name for me? Ann Smith, okay. And your date of birth? 9/24/86. Okay, thank you for that. And I verified Ann Smith 9/24/86 on the ID bracelet of the patient by confirming by looking at the patient's bracelet. And would you happen to have any allergies? No? Okay. All right. And the doctor has ordered for me to come in today and insert an indwelling urinary catheter. And this is just so that we can monitor your urinary output. And did you have any questions? No? Okay. All right. So we're going to start by cleaning the perineal area. First, I'm just going to palpate your bladder to see if there's any distension. So before we do that, I would make sure that there is a mat underneath the patient. And I am I'm feeling, palpating the bladder. Okay. I don't feel any distension. Feels fine. You feel okay? Yes. Okay. And so now I am going to remove my gloves, wash my hands. I would don new gloves, and I am going to begin giving pericare. I would ask for the patient, I make sure the patient's in a comfortable position. I would elevate the bed. I'd make sure that the head is lowered, and I make sure that the patient is in a dorsal comet position with their legs flexed and wide open. I would start by having 2 or 3 wash rags and a towel, soap and water, and a basin. So I would, excuse me, start by cleansing top to bottom on the side furthest from me with the wash rag. I'd flip it and then go to the opposite side. So I'd start from the side furthest from me, move to the opposite side closest to me, flip the towel, of course, between each wipe. Now flipping it again to go down the middle. Now I would rinse with another washcloth, side furthest from me, top to bottom, side closest to me, top to bottom. Of course, flipping the wash rag, and then flip it again to wipe the region in the middle, top to bottom. Now I would blot dry with a towel, the side furthest from me, the side furthest from me, the side closest to me, and then the middle. And now I would, of course, ensure that my patient is covered back up with their sheet. I would remove my gloves. I would wash my hands, and I would don new gloves as I get ready to prepare my sterile fill. Now I have on my clean gloves. I would unpackage my remove the packaging from my sterile kit, the plastic wrap, okay, and I would throw that away. I am now going to begin opening my sterile kit from the top, side, opposite side, okay, and the bottom, okay. Now I am going to just move to the side to get this position so that I have room for my gloves. I am now going to remove my gloves, dispose of my gloves. I will take the other gloves that I have here, and I would then begin to put these gloves on. So I am starting by grabbing my non-dominant hand, grabbing the outer cuff, and I am putting on my sterile glove And now I am taking my dominant hand and I am grabbing cuff. Okay, we have that. And so now I am stepping back into my field. I would dispose of my glove. Now I would take my mat. I'd make sure that the sticky side is down. And I would tuck this underneath the patient. So I would ask the patient to let me tuck that underneath them. Now I would grab my other drape and I would lay that on top. Now I would start preparing my sterile field. So what I'm going to do here is I would attach my syringe to my catheter. All right. And I'm going to take out my cotton swabs and I would just drop my trash. I would make sure that I put the lube down for my, make sure I put my lube down. Oops. All right. Lube is down. I would dispose of that. And now I'm going to just walk out the tip of my catheter. I'm walking it out of this plastic sleeve. All right, and I'm lubricating it. Okay. And I am going to carry this over to my patient's bed. All right. Carrying it over to my patient's bed. And now I am going to hold the labia with my non-dominant hand, and I'm holding it open. I am starting with the side furthest from me with the cotton swab, top to bottom, trash. Now I'm going the side closest to me, top to bottom, trash. Now I'm going the middle, trash. Now I am going to slowly guide the catheter into the labia while I'm holding. I'm walking my fingers back. I had to grab it a little bit closer just to get a good grip on it. So I'm advancing about 5 to 7 inches until I see urine. Okay. And I see urine. I'm just going to advance a little bit further, maybe like another 2 inches. All right. Now I am going to I'm moving my non-dominant hand down as I inflate the balloon. All right, the balloon is now inflated. I held the needle, the syringe, making sure I held the syringe all the way down. I am pulling back for resistance. I feel the resistance. Now I'm advancing a little bit further. All right. We feel the catheter is secure. I would attach the catheter. I would attach the catheter back to the patient's inner thigh, and I would hang it from the lower bed frame. I would remove my gloves. I would wash my hands. I would don new gloves, and I would gather all of my materials and dispose of them. I would make sure the patient is in a comfortable position. Bed is in lowest position. Patient's comfortable. Head is elevated. Call light is within reach. I would make sure that I record and document measurement of urinary output, and I would complete my skills complete.